Hello again, everybody. This is Craig Evans of Autism Hangout, and thank you for tuning into this Autism Hangout feature program, another installment in the Ask Dr. Tony series. And I am absolutely delighted to meet one of my idols in person today, Dr. Tony Attwood. In fact, I just listened to him do a whole day seminar that was organized by a group called AEP Connections. That stands for Awareness, Education, and Potential. And it's a new startup that's going around putting together autism conferences, and they're bringing in speakers the quality of Dr. Tony. But after this whole day, what a trooper, he said, let's sit down and answer some of the questions that people of Autism Hangout have submitted. So I'm delighted to bring you this next installment. So welcome, Dr. Tony. It's nice to see you.
Oh, thanks, Greg. And it's good to be here in person rather than on Skype.
Okay, well, let's go ahead and just dig right in. The first question, Dr. Grandin sees the detail of things and has amazing insight. But being a person with autism, she misses facial expressions and nonverbal cues and such. How or why is this area of detail so elusive to the individual with ASD? And that was submitted by Barbara Zanis.
Okay, Barbara. As you say, the person with Asperger's syndrome can attend to detail. In fact, sometimes their attention to detail means they have visual acuity of an eagle. They really do spot difficulties. The person I was talking to recently said, when I look at old people, it's so upsetting because I see all the lines, I see all the aging that occurs. But it's not a question of looking at or finding the detail, it's where to look and what it means. Typical people will look at the eyes and eyebrows and the shape of the mouth, and it's the combination of them, not the detail, that is so significant. It's the brain structures that will analyse these cues, so it's not in the visual acuity. It's the brain's ability to identify which bits to look at in combination. What do they mean? That is so elusive with ASD.
We've also had responses from parents, specifically as it relates to their kids. This is from J1, and Jay writes, "Hi, as a parent with autism, I'd like to ask Dr. Attwood if he has any advice on parenting. The main problems I have relating to my children are," and he lists 5 of them here, so if it's okay, we'll go one at a time. "Do my children know that I'm faking it when I listen to them? In other words, I'm actually thinking out and processing their words versus just listening intuitively. And does it even matter?"
I think the best approach is to tell them that sometimes I may not look at you as much as you expect when you're talking to me, but it means that I'm really concentrating on what you're saying and preparing what to say in reply. I think the best thing is to be honest with them rather than don't fake it, explain it.
The second question is, how can I tell if I am being sincere in showing them affection? This is an internal question.
Oh, what a difficult one to answer. This is a heart-to-heart connection. And I think those with Asperger's, unfortunately, can lack confidence in some of their interpersonal skills. I think, again, ask the children, did you enjoy that hug? Did you enjoy that cuddle? And if they did, great. Sometimes we may be a bit technical and say, on a scale of 1 to 10, how much did you enjoy that? And if they say 8 or 9, it was a winner. It was okay.
But it's okay to relate to your neurotypical child by asking them for a sign as to how you're doing. Is that what you're saying?
Yes, because the person with Asperger's, again, may not be able to read the signals to be sure that it was successful. To another person, it was obviously successful. But the person with Asperger's isn't reading the signals. So the typical child may have to say, thanks, Dad, I really enjoyed it. That was an 8.
Very good. Part 3 is, since I can't understand subtle facial expressions, I'm encouraging my children to better express themselves verbally. Is this okay?
Absolutely. It's learning a language of Aspergerese. Be direct. Neurotypicals do white lies, they understate, they don't say things because it could hurt someone's feelings. I think they need to learn Aspergerese, and they need to express exactly what they mean, otherwise the parent with Asperger's doesn't get it.
You make this so much fun. Should I get my children to spend more time with normal people?
Yes, to a certain extent, as much as they feel comfortable with.
Okay. We didn't define normal, we're just assuming it's an NT, I'm assuming.
It's a statistical concept that doesn't exist.
Okay. At what age do children understand things like high-functioning autism in other people?
Probably when they're about 7 or 8 years old. Up to that point, differences tend to be in terms, if they notice it, in terms of skin colour, abilities and so on. But something like high-functioning autism that is a much more complex process requires a greater understanding of people. And for a typical child, about 7 or 8 years old is when they start realizing that people have different personalities rather than look differently.
The next question is from Canada. It says, hello, I'm Canadian with a 24-year-old sister with Asperger's syndrome. She's been chronically ill for the past 3 years and has encountered trouble dealing with the Canadian medical system, mainly doctors who are ignorant to autism spectrum disorders. It seems their vision is clouded by the diagnosis of autism. In fact, they appear to ignore her complaining of physical symptoms, thinking it's her autism that's causing her issues. This is a concern on many levels, most importantly, her appropriate physical care. How can I advocate for my sister, or how can she effectively advocate for herself when dealing with ignorant doctors? This is from Inkspot.
Unfortunately, this is not the first time I've known this.
Oh, my.
I've known it quite often. I do ask the medical staff, first of all, to look at autoimmune diseases. New research is suggesting that those with Asperger's and autism spectrum disorders are prone to autoimmune diseases, so they need to check that out. Secondly, people with autism have a different pain perception and a way of describing pain that may not be interpreted accurately by other people. We use a pain thermometer of 0 to 10 to indicate the degree of expression. Now, it means that sometimes light touch or a little bit of pressure or discomfort in ASD can be perceived as very intense, but it's perceived that way. That's how they feel it. Sometimes they may not respond to intense pain. So in ASD, pain perception is different, but pain is nature's way of telling you something's wrong. So there's something wrong with this person's sister. And in all the cases I've known, after intensive, prolonged medical investigation, they found something. But the person with Asperger's may not be able to precisely articulate the nature of the pain, but it's there. And so I do ask you to be your sister's advocate and say, there's something here that needs to be explained.
Tony, is there something in one of your books that you could say, take this book in and show it to the doctor?
No, but take in this video,
Okay.
if you can. There are, if you do an internet search, there are about 4 or 5 articles now on autoimmune diseases, and that really is of medical significance and has now been confirmed. But they need to say, well, where do I start? The usual way of starting, well, where do you feel the pain? Well, what could that be? But that may not be the complete answer, because the pain may have been transferred from someone else. They may not be good at articulating. They need a very good physical. Yeah.
Okay, so Inkspot, yes, you are advocating for your sister, and take this video in. You have Dr. Tony's word on this.
Absolutely. I have so many, at least 3 or 4 at the moment that I'm in email correspondence with, in trying to get the doctors to take their concerns seriously.
Oh my gosh. All right, next question is from Signs. I have a 20-year-old autistic son on Abilify that never wants to stop eating. When he wants more and I say no, he will sometimes hit his head hard and bite on things. What can I do to help him eat less?
The suggestion is that Abilify is contributing to this, and many medications used for emotion management have a side effect of affecting appetite. Obviously, it's beneficial for the emotions to be stabilized, but if the consequence is binge eating, and this is have a significant effect on his health, but now, perversely, his emotions because he's being stopped, then I would seriously look at whether Abilify is appropriate, the dosage level, or whether something else could replace it, or it could be stopped. If he's autistic, then clearly he has difficulty with communication, and we would need to find out exactly what's happening with regard to either anxiety, depression, or anger, and evaluate what's going on, and look at cognitive behavior therapy and a range of strategies that may mean that such medication can be at a very low dosage, or in fact abandoned. But if it's causing such problems of potential obesity with its medical issues, it needs to be taken seriously.
Next is from Irish Princess 16. She said, I'm a 20-year-old college student and I suspect I have Asperger's. I do not have an official diagnosis. Is there an advantage or disadvantage to being tested?
Oh, very interesting question. When I talk to adults who have had a diagnosis, and I say, has it been worthwhile? Invariably, they say yes, for a variety of reasons. It makes sense of past experiences. There's a logic. You can understand yourself, you can explain yourself. You can use your knowledge of strengths and weaknesses for better decisions in terms of career, relationships, etc. Now, if you're a 20-year-old college student and suspect you have, you're probably 80% correct. Because you know yourself, and if it makes your life sensible, then the chances are that you do indeed have Asperger's. If you're a college student, then it will be important for the college staff to know, because they may be able to give you advice in terms of not only potential careers, group work as a student, in other words, working in a team for a project, issues of relatedness with the other students, organising and planning projects, etc., and also being a bit more understanding about your eccentricities. When we look at the diagnosis, who to tell? Only those who need to know. So there may be a college tutor and others. Getting an official diagnosis requires someone who knows about Asperger's, especially Irish princess, girls and women. If you're in Ireland, I'm not sure who I would recommend. There may well be someone who could help you, but you need to make sure that they know about Asperger's in women, because otherwise they may say, compare you to the males they've seen, you're not identical, therefore you can't have it, without the knowledge base of girls and women with Asperger's.
If she's in the United States, is there a resource that she could contact to find somebody that qualified in perhaps her own town?
I think in Future Horizons, they have on their webpage a list of people. I can't vouch for the competence of those people,
Okay.
but they just said that we're involved in this area. There are two people that I would recommend in North America for this. Isabel Heno, based in Montreal, and Dr. Karen Grant. She is the clinical psychologist in Portland, Oregon, who's specialising in girls and women with Asperger's syndrome. She's writing a book on it at the moment.
Excellent.